You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Welcome to the show, Jo-Ann. We've been having plenty of exciting chats leading up to, this podcast recording. Your background is so fascinating to me. So I've really enjoyed chatting and learning more about you and what you're doing. So welcome. And
Thank you. Thank you for inviting me.
Thanks for being here. Thanks for taking the time. I always kind of like to start the podcast with a bit of background and info about, what has led you to today.
Well, it's been kind of a windy road, but not really when you hear the big picture. But I started in healthcare just over 15 years ago when I first moved to Vancouver from Winnipeg.
Mm-hmm.
And I started in healthcare marketing. And probably most of your listeners have heard of Paris Orthotics. So my role was healthcare marketing manager for local. And so really essentially I was reaching out to GPs and physios to help support finding solutions for foot pathologies.
Oh, right.
And that was where it all started. And from there, I went into a marketing role at Fortius Sport and Health. And most of my background has been in sport medicine and orthopedics. And after that, I did a pivot into operations, and I led integrated healthcare clinics for several years until I ended up moving to Uganda.
Yeah, and we will dive into that part because the global health piece that you have experience in is also super, super fascinating. So, not to gloss over that piece, I do want to do a bit of a deeper dive into it, but you're now back in BC and now you're actually consulting clinic owners and healthcare providers in this new role. So let's hear a little bit about that.
So when I moved back from Uganda just over 2 years ago, I was consulting for the same consulting company that I worked for when I was down there. And that was in the global development and global health world. And I just decided that I wanted to get back into my community a little bit closer. And my passion is healthcare and supporting our universal system as much as we can. And so I decided to kind of take all my skill sets and all of my background together and use it for consulting. So really my consulting business is supporting healthcare clinics, so allied healthcare practitioners, physios, and doctors. And also I work on the global development side still a little bit and also small businesses. So
yeah, I love it. And that's such a great intersection because clinics, allied health, doctors, they're all typically small businesses. And so there's, that aspect of it where you're running a business, but then through the lens of healthcare is such a great intersection. So that's super cool. I really like that. Yeah. What are the areas that you focus on in your consulting? I know operations and marketing and branding seem to be a big part of that. Is that kind of where you have niched into currently?
Yeah, I would say so. I think I am best. A lot of my roles in the past have actually been in startup phase of businesses. And so I'm really best in the startup phase or for business owners that are looking at taking a reflection and looking back and saying, okay, where is some opportunity to pivot or to make a change? Yeah. Probably one of my best skills is I can laser in super, super fast at opportunities and see low hanging fruit. My background I finished my MSc in 2021, and that's what took me down to Uganda. And where I pivoted there was really looking at doing what we called monitoring and evaluation. So using data for learning to monitor programs, USAID programs. And so that skill set in using data we actually used when I was working at another integrated center here too. And it's really about performance improvement and project management and using data for so it's not just traditional finances, it's how can we pull other data from your EMR to make your patient care better or improve the quality of your programs that you're offering or look at developing a program that might be helpful for your patients. So that is a piece that I really, really love too, that I think is something that I think a lot of especially health clinic owners don't have the time to look at or to do. And there's tons of great opportunities there too. So
100%. Well, and I like that too, because you're using human feedback too, right? Like the data in the
Mhm.
forms of like, what kind of programs would your patients want, or like what has their experience been, and then collecting that data. It's not just like the traditional, we've had plenty of conversations around KPIs and kind of the traditional financial metrics of a clinic. Like this
Exactly.
humanizes it a little bit more and helps to offer something that your patients actually might want, need, desire, or else, otherwise. So I think that's actually really cool to be able to take not only like the metrics and like hard data, but the actual human data within that too.
Yeah, it's more about kind of, and I'm very values based, so it's more about working with, yes, my ideal client is somebody who's really has a mission or has a vision, and it's about really closer to supporting patients or providing good quality care.
Mhm.
And how can they look at evolving it, expanding it? What does that mean for the owner? And how can we work together to introduce opportunities for expanding that? So,
Absolutely. Yeah. Yeah. So, obviously, like the startup phase is, I mean, that's so front loaded. It's so hard. It's so
mhm.
challenging. What are some of the, like, if you were to work right now with someone who is starting a new clinic, like, what are some of the big things that you have them like ask themselves, or like, what are kind of the big questions that you really look at, or the aspects that you really look at with someone who is in that startup phase?
I would say for startup, it's two things. Number one, it's really what's the vision? Really, what do you want to achieve? Where do
Yeah.
you see yourself in 5 years? And spending some time really unpacking that and putting some life around that. So there's the practical stuff that you have to do that everybody has to do that's really black and white. But I feel like where it gets life and really gets really interesting is going past that and really understanding what kind of an impact do you want to have. A lot of I'm not a physio, but I know a lot of business owners, and I'm obviously a business owner myself, and there's some people that are in it for the money, and then there's some people that are in it to really have an impact and provide great patient care or great quality care, and so really not losing touch with that, because I think in startup phase you can tend to
Mm,
just get so overwhelmed with the, as you say, the traditional KPIs, the financial stuff, but starting to put a foundation for thinking exactly what do you want to incorporate into this clinic that adds something different and that helps differentiate you.
mhm,
There's, I've worked with some great physiotherapy clinics and that have great reputations, and a lot of it's not, the brand came from the care that was provided, and it was a long term, you know, earned experience. It
yeah.
wasn't, here's a brand and I'm gonna kind of make that fit to whatever appears. So that's really what I believe in and what I would
Yeah.
try and help people uh
Yeah.
get going on.
I love that. Like solidifying the vision and the why is
Mhm.
so important, right? Like if you're going into opening a clinic to make money, good luck.
Yeah.
Like that's, first of all, those intentions are backwards. And second of all, like as we know, running a clinic is not nearly as lucrative as being a clinician. So you gotta have vision. You gotta have,
Yeah.
the desire to have impact and deliver quality care. And like these things need to be a huge part of your why and your vision because doing it purely for the finances is in this day and age, in this industry, this economy, no.
No, the truth is, I don't think there's a healthcare practitioner in the world that goes into their own business for making money. It's the same thing on kind of the GP side or the
Yeah.
doctor side of things too, right? It's a challenge to really make money, and so you have to have a different idea when you go into it, and I believe that most do, to be honest with you.
Yeah.
Sometimes that gets lost a little bit because people do become very focused on kind of the hard numbers and that side of things and other stuff that's happening in life, but
Hmm.
being able to really get that crystal clear in your mind, and then that translates more into your culture and your policies and your procedures and who you hire, and you know so there's always that, I forget what that quote is, culture eats strategy for breakfast. So it is, it's so important to really understand what you're trying to do because I think that that feeds your culture, but they kind of feed each other back and forth. But
Yeah.
just having a good vision is, I think, super, super important. And then from my perspective, it's about relationship too. Like it's about a good fit and a good relationship. And if there's somebody who just wants to is in it just to kind of say, I want to get to a certain, you know, net revenue or whatever it is by a certain date, then they're probably not a good fit for me for consulting.
Yeah, great, and, like, that's so it's so nice to have this kind of, like, inclusion and exclusion criteria to know
Yeah,
exactly who you wanna work with, right? Like,
yeah.
that makes the collaboration so important and so much, like, easier to define, so I think that's really cool. What are some of the, like, biggest challenges you see right now in I mean, like, starting a clinic, but also just running a clinic? Like, what's kind of your assessment of and I mean, I'm talking specifically physiotherapy, but obviously, like, healthcare in general is really,
Hmm.
really struggling, and, we have, like, GP clinics, like, walk-in clinics or, like, kinda private run GP clinics and allied health, and I'm sure a lot of these problems overlap, so I'm curious to know, like, what are some of the biggest challenges you see in the healthcare private sector right now?
You know, as funny as it sounds, I really think that advocacy is a big thing and expanding scope of practice for physios. Um,
Yes,
it's
yes,
just
agreed.
and then I'm working on, which I've told you about already, but I'm working on a small community of practice, just testing,
Mhm.
bringing allied healthcare, and I'm calling you allied healthcare, even though I think physios probably should be more considered primary care, but we won't go there right now. Um, on that, and just kind of bringing GPs and family medicine doctors together with allied healthcare practitioners to talk about how we can kind of bridge that gap between the universal side and the private side of things. I feel like
Yeah.
in a patient journey, there's so much that disconnection that happens there. And so anyways, that I think that that's a big piece and a big challenge for new clinic owners starting up. I guess I look at it as a huge opportunity to be able to
Yep.
address that in some ways, in different unique ways. I mean, there's also the like I was talking about the vision and making sure that the vision is translated into all of your staff and the physios that you bring on board, the team that you bring on board, that it's super clear exactly kind of what you're trying to achieve and everybody understands how they can contribute.
Mhm.
Um obviously, so that's, hiring and helping the team members with what does it look like to give good patient care and how are we measuring this and what does that mean to our patients and do we even have a good idea of who our patients are that are walking in the doors and what they
Yeah.
need and what they want, or
Yeah.
are we just assuming? And that's kind of where I talk about data and measuring. There's so many things that are measured from a KPI perspective, but I just think I've had some great experiences with pulling some really interesting data out of an EMR. And it's helped us not only operationally, but also define our patient better so that we
Whoa.
understand and know who's walking through the door, who's coming to our services and using our
Yeah.
services. And that applies more, I would say, more for kind of a general orthopedic PT clinic and not the specialized, obviously, because you know why they're coming. But
Totally, yeah.
yeah, there's a lot of general orthopedic clinics out there and there's tons that they could be doing too. So
Yeah. No, and I really like that. Okay, so tell me a bit more about this data that you're pulling. Like, are you looking at
yeah.
demographics, age, gender? Like, are you looking through any sort of like chart notes to find common themes in their injuries or the nature of their like, yeah, like what kind of data are you pulling here?
Yeah, so there's tons that you can do with your EMR. So when I was doing this, when I was working at an integrated orthopedic center, we were pulling data on basically diagnoses, um, patient demographics. So there's lots that you can actually be doing and tracking and then pulling reports on to be able to understand. So
Yeah.
that's one piece. Then the second piece of it is hearing from patients on a regular
Yeah.
basis. And it doesn't necessarily have to be a survey because some people don't like to answer surveys. It can just be certain questions that are asked. It can be one of the things that I was thinking about when I was thinking about the community practice is keeping some sort of a dashboard that is if a GP refers for physio when the patient, so this is on the GP side of things, but this would link things more
Mm,
closely, is if a GP refers for physio, oftentimes they'll either print or email a prescription for physio or say you need to go get physio. So
Yeah.
have a system in the EMR that actually says next time the patient comes in, did you actually go get physio? And who did you get it
Uh-huh.
from? So
Yeah,
linking those pieces, because we know it's a long time off from an EMR that's going to be shared amongst all allied healthcare practitioners. That's probably not going to happen in
yeah,
a long time.
yeah,
We
yeah,
know that. So having ways of closing the loop and also knowing whether you're providing the support that you need to. I mean, there's also obvious stats that you guys probably pull,
yeah,
caseload, how many visits per patient, those types of things, but doesn't delve
totally.
down deeper into the actual care and
Yeah.
answer the questions that really help to, I guess, you understand what are we doing well and what are we not doing well and what is our kind of competitive advantage and then build on that.
Exactly. Well, and I like that idea, obviously like on the doctor side of things, like finding out actually if they went to get physio, who they saw, et cetera. But then on the flip side of that, the physios, did you come on a referral from a
Yep.
GP? Great. And then, establishing that relationship, whether it's a quick email that's like, hey, thank you for your referral. I really appreciate that. Or maybe it's a quick update on the patient. Like you write the note,
Yep.
give the patient that to take with them. And yes, that's a lot more work. But oh my gosh, what the things that does for that relationship building, like now you've established trust with that doctor. Or like the doctor's like, oh my God,
Oh,
that
huge.
physio was amazing. They wrote me an update. How cool is that? Or pick up the phone. I had a chat on the phone with a GP. It was within interior health, like in
Yeah.
the public system, but I had a chat
Yeah.
with her and I was blown away at the fact that she took the time out of her day to have a chat, get my opinion, chat about this patient, make the best client-centered care decisions. And I was just blown away by that. And I mean, unfortunately, she's a GP in ChemLib, so it's not like she's taking on new clients. But
Yeah.
if she was someone, if she was a private healthcare practitioner, I would be like, go see her, get on her caseload. Like
Yep.
that was a caring, values-based doctor, and that was badass.
I totally agree. And I mean, there's a lot of research to show that integration works for better patient care. I mean, it's just everywhere. And, that was what I've so I feel pretty passionate about this because I started doing it when I was first working at Paris Orthotics. I mean, the
Yeah.
truth is we developed relationships to help provide and to provide solutions, and at Paris Orthotics, we send consult notes to GPs, and I know lots of physios do it, but I really, really do believe that the best relationship that you could spend time building is with referring physicians, and it
Mhm.
helps close the loop and it provides much better patient experience.
Yeah.
And really a GP, and then I experienced this when I was working at Fortius because one of my main mandates was because we were brand new,
Correct.
and nobody knew who we were. We obviously wanted to make sure that all the referring doctors in the area, primarily province, but main catchment area, knew that we were there as a source of MSK treatment for their
Yeah.
patients. And
Yeah.
so, developing a relationship with GPs is super, super important, super
Yeah.
important.
And, it's funny because you mentioned, like, we were talking about this previously as well. And, like, I know our association is really trying to do this too. Like, physios generally get positioned with the rest of allied health, right? Like, we get
Yeah,
positioned with like RMTs and chiros and that. And like, those professions are essential and necessary and amazing. And physios being primary care providers, having the ability to diagnose,
right.
that aligns us more with doctors and nurses and, pharmacists and dentists. And so the thing that I really like, I visualize a physiotherapy clinic where they're actually working alongside doctors and, pharmacists and like that group of people. Like, I think
Yep.
that in terms of an integrated clinic actually would probably help position the physios in, so Footbridge, for example, I know Fortius had the similar model where they had sports physicians
Yep.
working there. I think that not only optically like positions physios more in the like primary providership that we are like, because I find allied means like in the periphery, right? Like we're,
Uh-huh.
whereas like
Uh-huh.
physios truly are primary care
Yes.
providers. We can
Yes.
diagnose. We don't have imaging yet, but that's coming. We're fighting for it. Ontario just got it. We're getting it. Woot woot.
Yep.
It's happening. Hopefully. I mean,
Which should be a
you
huge win.
right? And so
Yeah.
having that and then being in alignment with doctors and primary care providers in a clinic facility patients are gonna get that full gamut of care. Now, obviously, we are not MSP supplied, and so the funding would have to come from the patients and their insurance and, all of that piece, but there's a shift happening, and I think you're absolutely right. Establishing relationships with other primary care providers is not only gonna
Yeah.
elevate the profession, it's going to give clients an even better experience, right? Like, I think this is twofold in that sense for everybody. It's a win.
Well, I mean, the truth is, you just have to listen to anybody who hasn't been working in the system. I mean, I've worked in
Mhm.
the system for so long, so have you, so has anybody that
Yeah.
works in healthcare. And know that really the issue, one of the biggest issues right now in healthcare is the lack of communication between all of the people that are looking after them,
Yeah.
taking care of them along their patient journey. And if that could improve, and if we could just find little ways to do it, it would probably make a huge, huge difference.
Yeah.
So anyways, that's my passion project. And that's what I
I
really,
love it.
that ties into kind of my consulting and my approach to consulting, my belief and my
Yeah.
values around it. But yeah, I think that there's huge opportunities to really build a business with that type of kind of values based thinking in, you know, and not necessarily by working better together with the universal system, I guess is probably a better way of putting it. I think there's huge opportunities there. So,
Yeah, absolutely, and even though
yeah.
physios are not, financed by the universal system and the way that doctors and pharmacists are, I do think there is a huge opportunity for that within the system as well, and
Yeah.
to be in that collaborative role versus more supporting role with that we've traditionally been seen as. So, yeah, I love that, and I think that the project is really exciting, so we'll do a call out at the end to, how people can get a hold of you if they
Yeah.
wanna participate in that because I think that would be really incredible.
Well, one of the
Um,
other things, sorry, just to quickly add
yeah,
this that
yeah.
I was looking for, and I don't remember the number right off the top of my head. What's the percentage of patients of it that a GP sees in a day that they refer to physio? I mean, it has to be a high number. I
It
would say
must
it's
be.
like gotta be more than 50%. I know the stats out there, but I don't know what it is. And I mean, physios are so relied on by GPs,
Yeah.
and it's just you're such a key point or part of the team that and we know that I was talking to somebody who works for the division of family practice, and they have the patient care networks, which is a similar kind of
Yeah.
model,
Yeah.
but it is here, they were saying in kind of, and I'm in Victoria, they were saying that it's not built out at all. Like there's just
No.
huge, huge, huge opportunities to do that. So
Yeah, they are building it out within the health authorities, I know, like, they're trying to roll it out here locally in Kamloops as well, and so
uh-huh,
it's coming, it is, for sure, and there's opportunities within the public system for physiotherapists in these PCNs as well, which I think is really cool. I think
uh-huh,
physios should be getting paid better to be within that in the public
uh-huh,
system, like, if we are
uh-huh,
gonna be part of that primary care network, we need to be paid like primary care providers.
uh-huh.
That's an aside, and that's an advocacy piece, and you're right, advocacy is, like, a huge, huge opportunity within all of this. So I love this. I love this because it's really, especially coming from someone who's worked in the industry for so long and has seen the work and the value that physiotherapists offer. Like, and then also like being able to see that physios should be getting higher fees and there should be more support in the public system in the realm of physiotherapy for, like if I had it my way, physios would be able to actually just bill MSP. It wouldn't be something covered by just extended health benefits. It would be the same as the GP model. And
Mhm,
obviously
mhm.
that comes with its own bag of problems and, like negotiating rates and all this kind of stuff is a challenge and fees and all of that. And I know that I'm not an expert in physician in their world, but I definitely think if I had it my way, physiotherapists would essentially be orthopedic MSK
Mhm,
doctors. Like
mhm.
they would operate the same way that a physician would in that clinic. They would bill MSP and the extended health piece would be, I mean, extended health would exist still if people wanted to have like added, sessions or whatever. But I think public funding for physiotherapy needs to go up significantly,
Yeah, yeah, yeah.
especially like if we are going to be going for imaging and that piece of it. So anyway, that's my thoughts. I don't want to end up in a world though where we're only allowed 15 minutes with patients because some of our best care happens in those 45-minute, 60-minute sessions. So there's
Exactly, exactly.
tinkering with that would be an issue.
And I mean, let's face it, like the whole integration piece and collaboration piece is complex. It's not
Yeah.
easy. It's not
Yeah.
easy to figure out. I mean, I've lived it for my whole health career that, there's challenges, there's, issues with it. But when you see it happen, you can see how well it works. And I think that also in terms of being able to advocate not only to your colleges or your associations, but also to the health authority for increased integration or that kind of support or changing the system
Mhm.
is requires data, and it requires showing that it works,
Yes.
and it requires qualitative and quantitative data. We know that. And so that's just a reality. Like, it has to be measured,
Yes.
because you have to have something to take to the bank or to show people, right? So,
Exactly, and government, that's what they need in order to provide more money. They gotta see, how it's alleviating funds over here, and so, like,
yeah,
what you're doing is so helpful in that because your role in, like, supporting clinics to, like, analyze their data and collect their data is
yeah,
is contributing to that, and so, like, your work really is in not only supporting clinics for the advocacy, but, like, knowing where they are offering, like,
yeah,
and amazing services and being highly impactful on their clients and community is,
yeah.
like, huge. So oh my gosh, we could, like,
Yeah,
stay on
we'll
this,
keep
like
going. We'll keep chatting.
yeah, there's opportunities. See
Yes,
see
there
what we're
is.
doing? We're, like, we're finding the opportunities. I love it. That's so fun. So, yeah, I mean, like, I'm really excited about this, and obviously both of our wheels are turning because that's just who we are as people, but, I wanna talk a little bit more about, like, the marketing and branding piece because like you said, like, having the vision and the why and that piece of it established first is essential. And then developing like branding and marketing techniques beyond that is so like I like this idea a lot. So I want to pull that thread a bit more. Okay. So like let's say you've worked with the clinic, they're super clear on what their goals and values and like, their why is. They've opened their clinic and now they're gonna like move into more like branding and marketing. Like what's the next step? What does that look like?
Well, I may be a bit controversial, but I will put myself out on a limb here and say that I don't think that traditional branding and marketing is necessary in a physio clinic, even though it's for profit, or even in a physician's kind of
Yeah.
center or environment.
Yeah.
And the reason why is because of what we've just been talking about. It is very relationship based. It is very much based on referrals. And I believe that if you know exactly what and who you're for and what you're trying to achieve, and you take that message to the people that are referring to you, or even if you do a little bit of end user marketing, my experience is all in marketing, even at Paris Orthotics, at Fortius, we did very, very little end user marketing. It was all geared towards the referring practitioners that were
Mhm.
referring to for our services. And I strongly believe that that is the best bang for your buck. And I know a lot of people would say, I don't have somebody that has the time to go out to see a GP all day or spend all day, visiting GP clinics and stuff. But at the end of the day, it doesn't even take that much. You can use your data, use your geographical data, position yourself, and know exactly how many GPs are kind of geographically located to you.
Yeah.
Understand, and then do a little bit of research and understand kind of what their patient load is. So do a little bit of matching and then work on developing relationships with them. Yeah, it's really about relationships, and it's relationships within your kind of professional realm, especially if you're specializing. But it's
Mhm.
also it's really relationships within the health world.
Yeah.
I'm not a huge believer that the first thing you need to do out of the gate is have an Instagram account. And spend a whole bunch of money putting together a bunch of Instagram videos and providing information and education for patients and stuff. We used to get a ton of requests for patient education and having time to educate patients about whatever they're diagnosed with is a huge, I wouldn't say issue, but it's an opportunity. It needs to be done. How it's done is a separate thing. I think that is not necessarily a massive priority. If you're doing a good job communicating with your clients, I'll say, when they're having their session, then I see that more as a need on the GP side of things, right? Because they have 15 minutes to spend with their patients. You have more time, right?
Yeah. 100%.
So,
Yeah.
yeah, I would say that the marketing is getting really, really, really clear about who you are and what you deliver, making sure that you're spending time knowing that your staff, and when I say staff, I mean your other physios and your op staff, are, you have a good culture and they know exactly kind of what the goal is, and the vision has been passed on. And then getting some really, really good relationships with GPs and other physicians that match or kind of have
Yeah.
similar practices.
Yeah, I love that. And like, you're right, it shouldn't be this big time consuming thing. Like, I think as a
Mm-mm.
practitioner, writing a quick update and like
Yep.
a, hey, I've been working with so and so. We've had a lot of success with this.
Yep.
I'm hoping you can maybe look at that.
Yep.
It just puts your name on the radar, right? So if you
Hmm.
see 5 people in a day or 10 people in a day, it's a 5-minute note. And, if you're seeing let's call it 10 people in a day, 5 minutes per note. It's not a lot. It's just a quick, 3-liner. Thank you for the great care you've provided. I have offered this. We are working on that. I'd love to know if you think X is appropriate. Great. If you saw 10 people in a day, that's an hour of your time. Spend an hour of your time writing
Absolutely.
those notes, email it to the patient and say, hey, next time you see your GP, can you pass this along, please? That
Yep.
1 hour is way more valuable than like the hour you're going to go and spend $500 for to work with a branding specialist.
Oh, wait. And here's another thing, too, along those lines. You're going to start to see trends. So you'll see anecdotal trends, but this is another piece of data you can pull in your EMR. You're going to see that this doctor sends me a lot of, let's just say, low back pain,
Yeah.
or this doctor sends me a ton of plantar fasciitis, or they send me a lot of ankle sprains, or whatever it is. And so you'll start to see those trends. And
Yeah.
so that will also help you to know how you communicate, or whether you pick up the phone. I've gotten 10 low back referrals from Dr. X in the last 2 weeks. Maybe I should pick up the phone and chat. So if you can establish that rapport and show them that you have solved their problem,
Mhm.
and I use that term loosely, obviously, their
Yeah.
patience, challenge,
Yeah.
then, they're going to you'll have a friend forever.
100%. And that also is really cool in terms of like what direction of education and training and specialization to go into too. Like, perhaps you're getting a lot of plantar fasciitis and you're really fascinated in the foot. Then you're like, hot damn, I'm going to go take some more foot courses and like become the expert in that.
Absolutely.
Right. So it's like
Yep.
kind of like if you're getting this feedback from the doctor by like getting more and more of these people, that means they trust you and so
Yep.
unless you like don't like working with feet, like it's actually probably a really great indicator that you've perhaps niched into something that's like
Yep.
working or,
Yep.
is offering a great service. So,
Yes.
yeah, I mean, unless you don't like it, like it might be an interesting area to continue to explore and pursue and pull the thread on professionally.
Totally, and if you don't like it, then that's an indicator too, right? Like, that's information, and so
Yeah.
there's something to do with that, there's
Yeah.
some action that can be taken with that, so that's the type of data that I talk about that I think is so, so, so important,
I love it.
when running a clinic.
100%. So I love this idea of the data and the feedback and like the clients and the people and the relationships. Like, and you're right, it's not just like this concrete hard data, but there's a feedback loop, and finding a way to quantify it or document it and like analyze it really is I think that's a really interesting lens to look at it from, because a lot of clinics
Mhm.
probably aren't doing that. They probably don't have the time to do it. So yeah, like hiring someone like yourself to put these systems in place for them is gonna make them, like, so much more efficient and successful.
Well, and that's part of the challenge with this, is that you have to take that time at the beginning. It does take building a platform, and it takes, consciously thinking about, what do I wanna measure?
Yeah,
And so you need to spend the time at the beginning to make sure that you put those systems in place to be able to collect that information so that you can measure it. But once you do that, it's a little bit of upfront work, but once you do that, like, it doesn't have to be something that's you spend copious amounts of time on,
yeah,
It's not doesn't have to be a big time sucker. It can be something that's looked at quarterly, or it can be looked at, you pick one report to look at monthly, and then you do a really kind of like a pause and reflect on it, and think, okay, what is this showing me on a quarterly basis? It's
yeah.
really, really important to constantly be looking at and reevaluating, am I doing this? Am I achieving what I started this for? Or have I gotten onto a hamster wheel and I just can't get off?
Right.
And understanding, because like I say, I think this goes back very much to people are in healthcare because they actually really care.
Mhm.
And so, have I gotten on that hamster wheel? Well, I'm just like trying to get staff hired and I'm trying to get people trained and I'm, just trying to keep my head above water. Or, those are important things.
Yeah.
But also at the same time, it's super important to be able to look and stop and think, okay, because that is the marketing of the business from my perspective. That is what it is. Being
100%.
clear
And
about who you are and what you want to do.
yes, and understanding who you're working with.
Exactly.
Huge. So I'm
Yep.
curious, like, what are some of the strategies that you can use to collect this data? Because obviously, like, a lot of it's probably going to happen conversationally. And then, I love Jane. Like, the
Yep.
reports you can pull in Jane are like, I am obsessed with Jane. Um, and it's like all the allied health professions use it, which is amazing. It's not as obviously as much used in the like physician
Hmm.
nursing world because it doesn't have the same capabilities as their EMR programs do. But in Jane, data collection and report generation is like incredible. And I know they also have all these slots on, like, for example, the intake form, like, who did you get referred by? Who did you get referred to? How did you find us? Like all of this stuff is
Yep.
built right into the intake form. And something I've often thought about is like having another intake or like questionnaire sent to them after like their fifth visit. Like, have you made any
Hmm.
improvements? Like, and I think there's an opportunity for clinic owners to actually do a lot of that because clients like to see it too. Like they like to be like, "Oh, hey, cool. Like my like session 5 check-in. Am I
Yep.
doing better?" Like you can actually create some of these automations within Jane and within different EMRs on that and collect data and do it that
Yep.
way. And obviously you can do it in a way too that's like you're in session with a patient and you can collect that. But then that often ends up in the chart note, which is a private document and blah, 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 blah. But if you actually did it in a way that was a little bit more like intake formy, not
Hmm.
survey-y. Yeah, I'm not sure. Any other thoughts on that or like ideas?
Yeah, I mean, I think so. We were looking at doing something like this too, doing kind of a patient journey surveys or mapping. First of all, it was mapping, but also it was a tracking kind of progress. And
Yeah.
that was on the health side of things. So it wasn't in Jane. But if you're looking at things from an aggregated perspective and canceling out all PII, you don't have any issues with privacy. So
Mhm.
it's more of a matter of using it for two ways. I look at because I love that idea. I think it's a great idea being able to kind of gauge because you have these things you can look at the top level data and say, okay, my average, appointments per patient is let's just say 6.
Mhm.
I'll throw that number out there. And but if you can't tie it to a specific pathology, you don't know whether that's good or not,
Right.
right?
Totally. Yeah.
So if you're not tying to a specific diagnosis or a specific pathology, then you're like, okay, so being able to link those two things, and Jane should be able to do that. You should be able to
Yeah.
pull a report.
Yeah.
And then the second thing is like, okay, but what happened along that way? And
Mm.
oftentimes you're dealing with like complex patients, right?
Yeah.
That's the truth that have maybe multiple things going on. And so
Mhm.
sometimes they take a divergence into something else. And so maybe that 6 is high because that number 6 is high for because something else happened along the ways or whatever. And also like that's where I also feel like some some qualitative stuff needs to come in here too. So
Totally.
to go back to what I was saying, I think it's useful data on an aggregate, but it's also useful data for the team in the moment, right? So, like
Yeah.
you say, in the waiting room and making just developing short 3 questions using an iPad, whatever, or having your team, your one of your ops team asking the questions or whatever it is. I mean, I think the nice thing about Fizzy is you have a little bit more time and you
Yeah.
have more of an opportunity to delve into some of those things. And
Yeah.
and again, it can show so much information that is useful for advocacy if obviously in a bigger picture. So yeah,
Mhm.
I think it's really, really important. And there's there's lots of different questions that you can ask, and I bet you that Jane, I haven't looked at Jane on the back end for a long time, but
Yeah.
I've been a patient,
Yeah.
a recipient of Jane, and I'm pretty sure that Jane has all of that functionality.
100%.
And I also would assume that they are more than willing to develop custom reports for you if you or for yeah,
I I think so
yeah,
too. Yeah. And
yeah,
yeah, I love this idea of like, yeah, more like gathering kind of on the spot too. Like even if you're taking a subjective history, maybe there's 3 questions you asked in that subjective history that
yeah,
aren't part of the chart note, and you obviously get consent from the patient. Like, "Oh, we're collecting some data. Like, can I, collect 3 questions?" And it goes into a like survey in
right,
Jane because you can have a survey
right,
and you do it that way. And then
yep,
that way now it's not confidential because they've consented to putting it in that, right? So there's
that's right.
tons of ways and nitty-gritty like pieces that we can get into, and I'm sure you do within your consulting. But I think this is like this is kind of like my mind is kind of being blown right now too on how data can shape so much. Like I'm
Oh,
I'm quite
so
blown away right
much.
now.
Yeah, so much. And the other thing that you say about that too is if it's asked, like you say, in a survey way where it's not necessarily tied to the patient's chart,
Yeah. Yeah.
there's
Right.
no you have no issues with
Exactly.
PII or anything.
And you
So,
just document consent. Patient consented to participating
correct.
in feedback survey, whatever it is, right? So yeah, that's huge. So
Yeah.
um I do really want to pivot into the global health stuff because I know you have an incredible background there. But before we do, any last kind of like bits or pieces that you want to share about like what makes a successful clinic or like starting a success oh my gosh, I cannot speak successful clinic.
No, I mean, I think that the one thing that I would say is like don't do it alone.
Yeah.
Don't do it alone. I think a lot of it's funny, like I'm not a physio. I would never, well, I mean, I couldn't because the college protects that, but I would never practice physiotherapy.
Yeah.
And I think that physiotherapists and a lot of people, this isn't just in the physio health world, jump into business and just are on this totally steep learning curve and just there's so much to learn and I don't think you get a lot of training in physio school on
No.
it and so I would say don't do it alone, and even if it's a matter of getting into like a group of peers that are also just starting their businesses or whatever it is,
Yeah.
and consulting doesn't have to be super expensive. It can be, very very customized based on what your needs are. It is I don't call myself a business coach because I'm a little bit, what's the word, like picky about the use of terms, and I don't have a
Yeah.
coaching certificate. So, I would call myself a consultant, but I think that, I would do one on one coaching as well. Like, I think that you have to get some support for whatever you can afford.
Absolutely. You're so right. Like so many clinicians are highly trained, like, educated, intelligent people in that
Very
space, but
much.
don't have the business background, right? So
Yeah.
having someone supporting them on the business side of things to like offer them that support and the techniques and the back end work that really is essential, especially in laying that foundation. I 100% agree with you. Like I wish I had had more, and I think this is just it, like, the resources don't exist. Well, they exist more now than they did 10 years ago, 12 years ago when I was in school,
Yep.
um, but there aren't a ton of resources for, like, learning business in the healthcare space, so I think what you're doing and I think, like, there are more people offering it now, it is happening, it's really great, and, there's space for a lot of opportunity for business support, education, consulting, whatever you wanna call it, coaching, in here, right? It's just about finding someone and, a community that resonates with you and fits with
Uh-huh.
you. But like, I would agree, getting training on the business side of things. Like, I didn't know what a P&L sheet was. I didn't know what a corporate permit was. I didn't know the difference between an IC and an employee. Like, I didn't
Yep.
know these things when I started and also didn't know where to look to learn about it. So
Well,
you're
and the
absolutely
truth is
right.
I'm not an expert on everything either. I'm not a lawyer.
Yeah.
And I'm not a regulatory expert like you are more of, and so that's why we met,
Yeah. Yeah.
so it's about, forming like your team or your board of directors, quote unquote, the people
Yeah.
that are going to provide support that you can call on when you need it. And in some cases they can save you making massive mistakes. In other cases they can just provide a different perspective that helps you to,
Yes.
take a different approach or a different direction that kind of propels you forward quicker than you would have if you had kind of tried to do it yourself. It's a big learning curve. And so
100%.
it's super exciting, but it's and also accountability, right? Like it helps
Yes.
sometimes it can help with accountability too and just keep you on the path and not straying off on other things. So
100%. Having that bench, like having your bench of players, you know? Oh, I'm
absolutely.
like bumping into some questions about regulation. Great. Let's call Danielle. Oh, I want to like figure out some new way to collect data. Let's call Jo-Ann, right?
Yeah.
Like
Yep.
having that bench and having those people and having everyone who like has their own unique view, lens, abilities. I think, yeah,
Yep.
I think that's really cool. So,
Or
yeah,
even says like you say, okay, well, I can't answer this question, but I can
yeah,
recommend a couple people who could,
100%.
right?
Exactly, and
So
knowing the strengths and weaknesses and areas of expertise, like, and making recommendations, like, yeah, having that good quality team, that bench built out and knowing, like and that's also the sign of a great, like, coach consultant, like, to me, is someone who knows what their weaknesses are. Like, finance is not my area of expertise. Like, I would never be like, "Let's build you, like, a bookkeeping
right.
system." Not my jam. But, like, you wanna make sure you're, like, well protected? Great. Let's build you some consent
Yeah.
forms and make sure we understand the T's and C's, and let's decide if I see an employee is, appropriate for you or if you should be direct billing like that. Yeah, that's my jam. I'm like, that's where I would excel. But, like, for me, if I'm trying to create systems to collect data, I don't know. Go see Joanne.
Yeah. Funny story. I talking about kind of building on your strengths and stuff. I always thought in high school that I was going to become a physiotherapist.
Really?
Yeah. And maybe that's why I have such a kind of affinity to working in healthcare and working with
Yeah.
physios and stuff. But I, in my first year of university, I got a D in chemistry. So that did that for me. I was done.
I failed it.
Oh, did you?
I failed in my first year and then I barely passed it in my second year. I don't know how I got into physio school. There was some I like literally went back after I graduated from undergrad and redid physics 12 to like
Did
boost
you?
my GPA. Yes.
It's one of those things that's, like, burned in my mind forever. I'll never forget my professor. He was Dr. Farmer, and he was, like, 95 years old, just, like, totally tenured and, like, ready to, like, retire anytime,
Yeah.
and he stood at the front of the class and just read out of the textbook, and I'm like, "I'm getting nothing out of this. Like, please end this now."
Oh my gosh, I love it. That's so
So
funny. My priorities in undergrad, especially that first and second year, were like Wednesdays at the Pit Pub. That was all
yeah,
that
oh,
mattered to
yeah.
me.
Yeah, exactly, exactly, exactly.
Okay, let's do the pivot into global health because I know we kind of alluded to it at the beginning. And so yeah, like we've kind of talked about your years in the healthcare system and your experience there, but there was like a gap in the resume that we have not touched on, and that is your time working in global health. Let's kind of get the overview of what that looked like. And I'm actually really curious to know about what aspects of it you draw into your like work locally now.
Oh gosh, well, they do overlap. So when I was working at Fortius, obviously I worked with Dr. Jack Taunton for years and years
Yeah.
and years. I met him when I first started working at Paris Orthotics. He was a
Yeah.
big, big friend of Paris's.
Yes.
And so my relationship with him continued. He was super, super supportive on CUSM, which we haven't talked about. Which I'll get into. But yeah, he's unfortunately passed away last year.
Yeah.
But he was a real connector and a mentor in some ways. And so he connected me when I was working at Fortius with a pediatric orthopedic surgeon called Norgrove Penny, Dr. Norgrove Penny, who is also a big mentor of mine. And Jack said, you really need to get in contact with Norgrove. I'm going to introduce you because I had been going to Uganda for about 4 or 5 years before that and volunteering. I just fallen in love with the culture and
Mm,
just and I was actually volunteering in a healthcare setting there as well then,
yeah.
with a friend of mine who had a small nonprofit kind of she was a midwife in the NHS.
Mm, wow.
And so anyways, I met Dr. Penny, and he had started an orthopedic hospital in Uganda called Korsu. And he said, there is a growing population in the global south of middle class people who we're starting to see the need for MSK support and more hip OA and more knee OA and more diabetes and just things that hadn't been seen as much
Mm.
in the global south. And so he said, there's a desperate need for increased non-operative MSK training.
Wow.
So yeah, so I started a small nonprofit called CUSM, which is called the Canada Uganda Sport and Exercise Medicine Group. And we built that, and I say we because it was a whole group of amazing clinicians that, we all worked together. We built that over about 10 years. And really it involved bringing well, it involved a lot of things on the kind of partner engagement side, on the side of Uganda, but from the Canadian clinician perspective, really essentially what we provided was training in MSK medicine for Ugandan health practitioners.
Wow.
And so we would do anywhere we started doing kind of 1 3-week trip per year, and physios, pedorthists, sport med docs we'd all go on a big trip and see athletes do so we did big clinics and then did a whole bunch of teaching. And this was in conjunction with their sport governing bodies, the Uganda sport governing bodies, and it was just incredible. And over time we built relationships with universities and kind of grew our curriculum, and then expanded to two trips per year and kind of ongoing, we did webinars and things like that. And then so during that period of time I had finished my MSc, and I just knew that COVID hit, which of course is a big pivot point for everybody in their
Yeah.
lives.
Yeah.
And I knew that I was finished my MSc during COVID, and I knew that I was going to want to spend some time kind of reinvigorating CUSM and just living in Uganda. So CUSM couldn't support me financially, so I had to work, and
Yeah.
I ended up becoming a consultant for a company that had a grant to monitor and evaluate all of USAID's programs in Uganda, which,
Wow.
really ranged from any health programs. I shouldn't say any health programs, some of their health programs, not all of
Yeah.
them, because some of them fell under the CDC.
Right.
So some of their health programs, some of their global health programs, some of their economic development programs, really anything. And it was all about monitoring and evaluation, but also some strategy stuff. Like I worked with USAID leadership to develop their USAID Uganda global health strategy and really look at what are the challenges in global health in Uganda and understand what they need. And yeah, it was a
Wow.
great experience, fantastic, and, I feel like I was really lucky to have been able
Wow.
to do that, yeah.
What an amazing opportunity. Does CUSM still exist?
It doesn't how should I say this? When I knew that I was gonna be moving back, I knew that kind of my time traveling back and forth to Uganda was gonna be ending. I had
Right.
spent probably 9 years taking all my leave time, all my holiday time, traveling back and forth to Uganda, and I
Right.
just thought, I'm not gonna wanna do that anymore, so I passed it on to a sport med doc who's Canadian, but he lives in California. And so he
Got it.
does a little bit of it,
Yep.
but he hasn't really continued it that much. He still has
Right.
contact with some of our main contacts that we made there, and I think provides support in that way, but I don't know that they've done any real trips,
Right.
which is unfortunate, but hopefully
Yeah.
they'll
Yeah.
be
Oh
able to
my
pick
gosh.
it up.
What an amazing, like, unique experience. I think that's really cool. And actually, like, one of the questions I wanted to chat about is like, you see lots of opportunities for physicians and nurses and surgeons and stuff like that to go abroad and work in global health. And, as we know, physiotherapy being this primary care provider piece and like really, advancing the profession in that sense, like I think there's absolutely a growing role for physiotherapy in the global health world, right? Because I think a lot
Mhm.
of people think of it as like rehab from an injury and very sport oriented. And it sounds like CUSM actually really had a huge sport aspect. And obviously, like some of these African countries are producing, like, some of the most, like,
Yeah.
elite athletes in the world, right? So
Yeah.
that's obviously a huge component of it there, but, like, I spent some time in India during my physio training, like, during my
Mhm.
master's, and, um, there was absolutely a role for physiotherapy in that even just, like, kinda
Mhm.
homegrown local village aspect. So, I'm curious to know about, like, what do you where do you see the role of physiotherapy in, some of these more global health initiatives?
I mean, I think there's a huge role. It was interesting because that was one of the challenges that we faced. Like, if we called ourselves sport medicine, we had only athletes coming to see us, right? And and yes, we did see a lot of athletes, but the truth is there's a lot of people with MSK injuries and
Mhm.
MSK challenges that weren't athletes that needed support and needed help. So that was one of the things that we had to work on. Um, you know, at Corsu, the hospital in Uganda, there's, a whole physiotherapy department. And I know that in Uganda, they were switching from a bachelor or sorry, so they follow the UK system. So they had a certificate, a diploma, and then a bachelor. And so they were just actually moving the Ugandan government was moving towards bachelor physio. So they were escalating and elevating the profession for sure. It's definitely growing. I think there's
Yeah.
huge opportunities because of the change in the population. I mean, there's definitely more people it was a hard sell at the very beginning because when people think about health, they think about public health.
The public health is what and, like,
Yes.
that's what we were doing in India, was more of a public health initiative. We
Yeah.
were working with children and spinal cord injuries and that piece of it, but I think you're right. I think shifting that lens, like, from just public health or just sport and exercise is, like, there's a huge expanse.
Huge. So there's a huge expanse and the physios, especially at Corsu, had been working with like clubfoot, we'll just say, and like other public health issues with kids that had orthopedic problems, but then they were getting super excited about being able to like help people with and know how to treat people that had other MSK issues like ACL tears. Their surgeons knew how to treat that. They were being trained how to treat it. So what do we do post op now, and things like that. The
Yeah.
issue is so it's a change and it's a shift, I think. It's a shift from thinking that healthcare is public health to moving that shift that there is other components to healthcare.
Yeah.
And then I think, physios in Uganda made about $1,000 a month, maybe.
Right.
And that was, I mean, a decent if you're a national or a local, but if you're, somebody coming from the West, like, I mean, you just you can't
Yeah.
live on that. So, there's some changes and there's huge opportunities and stuff. There's an organization called Seed Global Health
Yep.
that they, do a lot and they did a lot in Uganda on the training piece. So I think in terms of for physios who want to be able to work in global health, there's some organizations that exist that I think actually pay people to and supplement income to go down there. And a lot of times it's on a short-term basis, but it's very much training based.
Mm.
And so those types of things exist in terms of going there and making a living. I had a friend down there who actually worked at Corsu. She was an obstetrician and gynecologist.
Mhm.
And she made like next to nothing. She was down there with her partner, and her partner was the main income earner. And she was just somebody who, this was a choice that they made as a family to live down there. She didn't
Right.
have to have the pressure of having to make more money. She was paid by an NGO, and
Right.
supplemented by an NGO. So, even doctors there don't really make a lot of money. So,
Wow.
yeah.
Yeah, wow. Yeah, it's so interesting too, and I really like the idea of, like, making it educational and training based because, I think with a lot of global health initiatives, there's always kind of this potential perspective of, like, like, kinda like the Western savior who comes and does a whole bunch of work and then leaves, right? So having this education and collaboration and, like, imparting, an exchange of knowledge within that, I think is huge, and I know that was a big part of what we did while we were in India too, is, like, we learned the hands-on skills from the workers that we worked on, and then in exchange
Mhm.
offered, like, education sessions on more, like, the physiology and the pathology of, like, conditions and whatnot, and so it felt a lot more collaborative versus sort of like, let's just, like, zoom in, see a whole bunch of people, and then leave, right?
Mhm.
So
Mhm.
I like this idea of, like, the training and education and, like, collaborative work and, like, how can we support each other?
Well, the truth is that Western healthcare practitioners have ton to learn about public health. Like, it's just the truth, right? Like,
Yeah.
like, that's just it's just a flip-flop, It's not a common thing up here, and it's a real specialty, and
Yeah.
so, like, our whole team would go down, they would not know anything about malaria or anything about clubfoot or anything about, any about treating any of that stuff, and so there is a lot to learn, like, from each other, and we experience that for sure.
100%. And like,
Yeah.
it's so like, it's so fascinating. Like, being in India and learning that, a lot of the stuff that we were seeing was like there was a lot of cultural aspects to it. And, I won't dive too much into it, but like, for example, like having a child with a disability was often, like a blemish on the family, right? So there
Mhm.
was like that cultural aspect to it. And it's been really interesting to come back here and, like, have a little bit more of that understanding that, like, sometimes these things have way more cultural pieces to them than just simply being an injury or a condition, right? Like, there's a lot more to
Huge,
these things than we're
huge.
used to here anyway.
Well, when I was down there, one of the projects that I worked on was kind of a focus group, collaborative project at Corsu where we essentially interviewed kids at the hospital about what their experiences were when they tried to participate in an activity. Because in Uganda, as in a lot of, I would assume, kind of global southern opportunities, it's very rural,
Mhm.
and so people play soccer or football on their made up pitch and stuff, and kids with disabilities, they reported to us just the feeling that they got when they were just left, to in
Yeah.
their sit in the house, and so we ended up
Yeah.
writing a storybook about it and
Oh,
having it illustrated and selling it, using it as a fundraiser for the hospital. But it was
wow.
so amazingly poignant hearing these kids tell the story about what it's like to, if they have a disability, what it's how just
Yeah.
ostracized they are. So, yeah. Yeah.
100%. And I mean it like the same sentiments I believe exist here too, right? But hearing it from that different cultural perspective, like that's kind of a ubiquitous thing that happens is like
Mhm.
those feelings that the kids have. Wow. I love
Yeah.
that story. Oh my
Yeah.
gosh.
Yeah.
That's so cool. I know we're getting kind of close to time here, so I don't want to I want to, make sure that we hit on all the things, but I want to know like how has your experience abroad and specifically in Uganda shaped your view of the Canadian healthcare system? Like what aspects of it? And I mean, obviously like being values, intentional, mindful, all these things that you've talked about in the beginning in terms of like integrity and values of a clinic owner,
Mhm.
I
Mhm.
assume are a large part from that experience too. But like, how do you pull it all together? Like, what are the things that really have the common thread here?
I would say, well, yeah, definitely. I mean, my experience was incredible, and I learned a lot about myself and just about the world. I mean,
Mhm.
I'm so privileged, and
Mhm.
I don't people that would say to me before I went there, it's going to change your life, and I hated that because I felt like, oh, it put so much pressure on you. But the truth is, like, living in a developing country is a very, 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 very different experience,
Yeah.
and you really, 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 really become. I became more patriotic,
Wow.
and I became much more appreciative of my country and realizing what we have. And I think I became even more passionate about keeping or supporting our health system and making it more sustainable because I've seen I did my MSc thesis on the Gambia, the health system in the Gambia. So I've seen health systems in Africa. I did my university through the NHS, so
Yeah.
I know a little bit about what it's like in England, and, I mean, our health system is not perfect, but we're very lucky to have what we have.
Wow.
And then the other piece that I would say that was so inspiring is that you're right, you can talk about kind of the white savior side of things, and you get these people from all over the world coming in, and especially in the health realm in the
Yeah.
Global South, coming in, experts coming in because they wanna volunteer, but the truth is, you know, the people that are the beneficiaries or the recipients of this training are getting some of the best training in the world because they're getting so many different perspectives. And that doesn't necessarily happen when
Yeah.
you're in a system that already has its own experts. You just don't get that opportunity to collaborate. And it
Yeah.
was incredible, we had lots of discussions about, and got lots of great questions about how to rehab an ACL because there's different
Yeah.
ideas and thoughts about it. And, you know, so they actually, when I say they, I mean Ugandan practitioners, physios, were trained in multiple different ways and had different experiences with it. And so they become in some ways better practitioners because of that. So
That makes that like, I actually really like that. Yeah, you're probably getting practitioners from all around the world, different continents, different
yep.
perspectives and backgrounds coming and delivering education on these trips or on these exchanges versus, like, being in Canada and just getting a set of, like, ACL protocol from the surgeon who
Yeah.
did it.
Yeah. Totally. And then you become a
Whoa.
lot better. I think, people that are beneficiaries of that information just become a lot better at listening and accepting different perspectives.
Yeah, and diversifying, probably trial and
Yeah.
error, like, they're way more discerning, I'm sure, like, there's
Yep.
there's a lot of, like, really big benefits to that. I mean, we can talk more about this, but I would be very curious to actually participate in something like this because I'm very fascinated, but that's a whole other
Yeah, and the thing about CUSM is that we had sport med docs, we had physios from all over the country and the US. We ended up
Yeah.
having some US doctors and physios, and we bonded so much because we spent 3 weeks together, and we would do safari at the end, and it was just an incredible experience. And I had multiple um sport med docs and physios say to me, I've been wanting to like contribute and to do something like this with my skill set. I'm a sport physio and I haven't been able to find anything aside from
Wow.
supporting major games or something like that. And so yeah, it was very unique, and it was a great experience.
Wow. Yeah, okay, noted.
Yeah, I can
Yeah.
introduce you to the doctor who's
Yeah, yes, we'll make a game plan. So I know you've got a million projects on the go and they're all so fabulous. How can people connect with you? What are you working on? Who are you hoping to connect with? Yeah, and what's kind of your call out and what are you hoping to connect with and build with other people?
oh gosh. So I am, if there's any physios that are working, preferably clinic owners, but also if you're working at a clinic in Victoria area, I'm working on developing a community of practice for looking at how we can integrate better, and collaborate better with primary care. So that's a very quick kind of snippet of that. And then for my consulting business, if anybody's interested in working with somebody who is kind of values and mission based and starting up your own clinic and you have questions, just reach out.
Yeah. How can they get a hold of you?
You can go on my LinkedIn, or my website is AFYA Consulting. It's AFYA consulting.ca, and AFYA means health in Swahili. So it's a
I
callback to
love the
my African
callback.
roots. Yeah.
Exactly. Oh, that's a
Yeah.
nice, like, bow full circle. I love it. That's really cool. And there's another thing that you've drawn from your experience there too. So I love
Exactly.
it. Jo-Ann, thank you so much. I like thoroughly have enjoyed this conversation and
Yeah.
we obviously chat, like
We
when
always
we
do.
when we
Yes.
chat, it just flows. So there's
Totally.
more to be had here. And so yeah, I'm sure we will do this again at some point. But yeah, thank you. Thank you for
Yes,
your,
thank
like,
you.
unique perspective and experience and just really refreshing take on the industry. So I appreciate it. And yeah, let's do it again sometime soon.
Okay.
That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.